The reason for the nomination for the award is that the fact that we've successfully achieved the transfer of community services over to the Acute Trust, and a combination of all the partnership working that's been done over the last few years across the Fylde Coast. My view that my nomination stood out, I think, is because of the examples we've got of joint working with not just the local authority, with the police, with other agencies in the town, and the great achievement we've got working with the local football club, and the recognition we've got for the Olympics. I've worked for the NHS for over 30 years now, and for the last 10 years I was the Chief Executive of the NHS in Blackpool, which is around very significant partnership working across all agencies. Recently transferred to Blackpool Hospitals Foundation Trust, and leading now the transformation and the partnership working still across the Fylde Coast. So I suppose I've been partnership working for over 30 years. I think my success as a leader is around working with people, building relationships, working together, seeing everyone's strengths, seeing everyone's skills, and starting to work together on that. For me to win the award, I think it'd be nice recognition for the work that's been done for the last years, and recognition for the other people who've played a part in that partnership working as well. Because you can't do partnership working on your own, you've got to work with all the agencies. So it'd be recognition for all the people I've worked with and all the people who've supported me in that partnership working. I'm really passionate about the NHS. I'm really passionate about what we can achieve and making a difference for people, for the patients that we treat. I've worked across all areas of the NHS over the 30 years, and I believe that we can make a difference, and if we can start to prolong life expectancy and cut back disease, then that's a major achievement to save lives.
I think the standout features of the nomination are the actual partnerships that we had to be involved with along the way. So we accessed a couple of people who'd written articles, met our chief executive, liaised with Sky Sports. One of the sessions was delivered and filmed by Sky Sports for their weekly magazine programme. We had to deliver the training session before the Rugby Football League agreed to do the round of fixtures to all the chief execs in Super League, which was an interesting day out.
I think what's been fantastic for us really is when we sort of spoke about this first, and then all the other people who became involved, who wanted to become involved, who wanted to be a part of this, who wanted to help to get the project on the move and spread it as far and wide as it's gone, because it's gone national, hasn't it really? It's the interest in it has been phenomenal.
I think the journey for myself as a leader has been involved in getting involved with key individuals in other agencies, inviting them in, making it feel a very, very worthwhile project to be involved in, and then seeing the benefits of that major publicity via Sky Sports and having input with the Rugby Football League itself, I think, has made that journey a little easier for us, I think.
It's just given a huge, huge profile really to mental health, mental resilience, what to do to keep mentally healthy, and also contacts and what you need to do. I mean, our presentation was around Help a Mate, wasn't it, for the rugby league players, which being a big social group, you know, that sort of sold it to them. So yeah, it's been absolutely phenomenal the way that it's taken off.
The success of the project, I think, would be down to that personal touch of liaising very, very specifically with former players when devising the content of the presentation. They gave us very clear steers on what probably would work and what wouldn't work. Keeping all the stakeholders involved in terms of the Rugby League on our project board and all the NHS partners that we've been involved in. So I think that personal touch and being very, very positive and hopefully enthusiastic about it means that it's helped that success.
I think the success has also helped to be driven along by because mental health has never been made, there's been no mental health awareness within Rugby League before. So getting the players involved and, as Phil said, the personal touch. There's been a big drive around player welfare, which all the players have wanted to come on board with, particularly in this field, because it's something that they've never given any attention to before.
I understand the reasons for this nomination are that we've made a considerable progress as an organisation, and in the last 5 years we've really worked hard on developing partnerships with the cultural sector, business sector, academic sector, and our cultural and creative strategies are really impacting on the organisation in a positive way, and they are extending our imaginations and also helping us provide practical programmes of support to our service users, carers and families. I hope our nomination stood out to the judges to be shortlisted and made a finalist, because they recognised the ambition and the scope in this work, both in improving the quality and care of our services and in stimulating a wider conversation with more people. I believe very strongly that health belongs to us all, and some of our partners are really interested in engaging with us to contribute to that, whether they're part of the business community in Liverpool and Merseyside, or the cultural sector, the academic sector, communities. We all have a collective responsibility to create health and well-being, and I think that's quite a novel and creative approach. To us in Merseycare to win this award would really put the icing on the cake. We're very proud of the work that we've done so far, and I think this would recognise all the efforts of a large network of people who go that extra mile, so it'd be great. I believe in distributed leadership. We are all leaders of something. And I think when you create opportunities and spaces for people to come together and to reconnect with what matters to them, you generate a new kind of energy, fresh ideas, positive actions, and that's got to be good for health and well-being.